Okay, this section is more on joints. So these are specific synovial joints that we'll look at. There are 5 main ones: your jaw, shoulder, elbow, hip, and knee. The jaw is called the temporomandibular. That's spelled wrong. Okay, so the jaw joint is technically a hinge joint, but it's modified. The condyle, which is that little like nook thumb sticking out, articulates with the temporal bone in your skull, and you have a ligament that supports it. So there's 2 types of joint movements there. There's the hinge joint part, and then there's also a gliding joint or a gliding movement that enables you to grind your teeth, and it can be really easily dislocated, and you can have a lot of problems with your TMJ, or temporomandibular joint, which you probably might have heard of. So here it is. There's the ligament that connect the two, and that allows you to glide and hinge, like open up your mouth, but also grind your teeth. So this is, let's see, where are we? So here's the cartilage in between. You have the synovial membrane here, so it is a movable joint because it has a synovial membrane. You have articular capsule here. This is your ramus, which we saw earlier in the skeletal system. And so that's how it's going to move and be able to glide. And it can be very easily dislocated. So here's your little condyle there. And then the movement can be side to side, and that's what happens when you're grinding your teeth. Okay, so TMJ, dislocation of your TMJ is very common because the socket isn't very big when you're moving your joint. It always dislocates anteriorly towards the front, so the mouth can't close, and it can be really painful. Symptoms of that: ear and face pain, tender muscles. You can hear a popping sound, so they might listen for that, or they might feel for a popping sound when you open your mouth. And it's usually from grinding teeth, but it could be from other things. Okay, then the shoulder joint. So the shoulder joint is the most freely movable joint in the body, therefore it is injured a lot. It's a ball and socket joint, and it's not super stable, and that's why it's so movable, and that's why it can be injured a lot. You have an articular capsule that is thin and loose, and so you can injure it really easily. So we already saw this picture, but you've got the bursa there. You have a tendon sheath that covers that tendon, and then you have a synovial membrane down here, and you can see the ball and socket shape there. So check out all these videos in both. I guess there wasn't a lot in the first one, but this one has a lot. So check these out so you can understand how the shoulder moves and how these joints move. Okay, so here's a real photograph of it, and hopefully someday maybe you'll be able to actually look at a real example of one. And so you can see the ball and socket shape there, and the articular cartilage on the outside there, and then the cavity there. Okay, it's also called a glenohumeral joint. I don't know if I said that. You have a glenoid labrum, fibrocartilaginous rim, and it adds a little bit of depth, but it's still not a very secure joint. And then you have some reinforcing ligaments, and these can be torn. Like, these aren't it's not very structurally sound. So let's look at all of these. So you have this ligament right here that joins the acromion, your shoulder, with the coracoid process, which is on your clavicle. And then you have this coracohumeral ligament. You have this transverse humeral ligament. And then over here, this articular capsule with a glenohumeral ligament. This is the tendon that's going to connect to your subscapularis muscle, and there's your scapula. So you have all these ligaments, and they do allow for a lot of movement, but they're not super secure. And then here is your glenoid cavity, and then you have these ligaments that are like wrapped around. This is the articular capsule that can be damaged pretty often. So that's kind of a side view, and you can see there's all these layers, right, to protect this but it's a very loose joint, and we use it a lot in ways we shouldn't. Okay, so the reinforcing tendons that connect your bone and muscle are going to provide the most stability. You also have 4 rotator cuff tendons that you probably heard of: the subscapularis, the supraspinatus, infraspinatus, and teres minor, that are connecting to muscles. So here is the rotator cuff muscles. Like the tendons are connecting to those 4 muscles. And those can be torn very easily too. So shoulder dislocations are very common because our shoulder is so movable. So these structures, like those muscles that are connecting your bone to muscle, or the muscles that are connected to the tendon and bone, can become weakened, and then they can become damaged. So that's why it's important to keep your muscles strong so that they're able to support these joints. Okay, so watch this video about the rotator cuff muscles and you'll be able to see what they look like. Here's another one. And then how that joint moves. And then this one is also movement of that joint, and so is this one. So watch all of those so you can really picture how they move. Okay, that's the elbow joint. So this is a hinge joint, and it connects the trochlear notch of the ulna to the trochlea of the humerus. And we saw this in chapter 7. We saw like what that elbow looks like, and that's a little corner of your ulna. And you also have ligaments that protect it so that you can do that kind of that unique motion with your arm. And here is a video to watch showing that. I think I skipped one. I think there's 2. This is B. Okay, so here is your elbow joint. And you can see your ulna kind of creates a little cup there. And then your humerus fits into that notch. And then you have all this protection there. So here's the bursa. This is the tendon of your muscles connecting it. Like the origin is up here on the humerus, and then the insertion is on the ulna, which makes sense. And then you have your synovial cavity there kind of surrounding it with your articular cartilage protecting the end of that bone like we talked about. And then there's an articular capsule there. So the elbow is not as often injured as like the shoulder and the jaw. Okay, here are some ligaments. So you have this annular ligament. I think that the elbow is more ligamented and more secure, more stable than the shoulder. And it only does that hinge motion, and then the twisting there is involved too. Remember all the markings that we saw, those bone markings? Here's an example of one. This is why you have that little lateral epicondyle, and then this radial collateral ligament ties into it. So all of these little nooks and crannies tie into ligaments and tendons and articulate with bones and things. And then that's your articular cartilage. Okay, and this is a real one, so you can see what those structures really look like. And there's a video for you to see how the elbow moves. And here's the other look at it, the medial view. And you can see this ulnar collateral ligament, and if there's 3 parts to it, and then you have this annular ligament here, and then the articular capsule. And there is another video that is worth watching. Okay, now we're looking at the hip, which is also called the coxal joint. This is the ball and socket joint. This is very often broken, especially in elderly people with osteoporosis. It's has that head, which is part of the femur, and then it articulates with the pelvis with the little cup-shaped acetabulum. And you have a rim of cartilage there. Hip like you have to be in a pretty bad accident to get a hip dislocation, but that bone is like the bone that's the neck coming off the head of the femur is broken a lot. So this part right here is commonly broken, but a dislocation in your hip, like that would have to be a pretty bad car accident. Like if you drive, if you are like me, a passenger princess, and you drive with your feet up on the dash and you're in an accident, that's where you're going to dislocate your hip or break your femur. Okay, so you have the synovial joint right here, coming around, and then you have your articular cartilage protecting that ball and socket. A little acetabular labrum right here, and then this ligament connects the head of the femur to the acetabulum. And one of the reasons why this isn't dislocated very much is see how far in the head is, like how far in it's connected to the acetabulum. The other ones are more shallow, but this is really, really a lot deeper into that joint, and so it's really secure. Okay, so there's a video showing hip movement, how that ball and socket joint works. And here's a real view of it. Okay, so here's the ligaments you have. You have the iliofemoral ligament, the pubofemoral ligament, the ischiofemoral ligament, and then the ligament that is to the head of the femur that we just looked at. And that one isn't as important, doesn't stabilize as much. Okay, so here are those different ligaments, and they're helping to connect these. So the ball is right inside there, and then the acetabulum is right there. And there is an anterior view of it. So this is more secure than the shoulder for sure. Okay, and you can see how that rotates in that video. All right, then for the knee joint, also a common injury, more common than the hip, probably. I've had a knee injury and had to have surgery, and they can be pretty traumatic, like pretty rough. I think what I was surprised about was that, like, how much you depend on your knee because it's bearing your weight. And so I think that's different from a shoulder, because you can still walk with a shoulder injury, but you can't walk with a knee injury or a hip injury. So there's 3 joints. The knee is very complicated in terms of this joint and all the ligaments that are connecting it. So it is a hinge joint. You have the femoral patellar joint, and then you have a lateral joint and a medial joint. And then you have menisci between them. So you might have heard of people, or you might have damaged your meniscus. So here's the knee. It's complicated. There's a lot going on. So you've got this tendon hooking up here. You have your patella, which is a sesamoid bone that you can kneel on. That's the bone when you're kneeling that can withstand a lot of weight. Like you can put all of your weight onto the patella when you're kneeling. And it's kind of floating there. And then you have this articular cartilage between that and your femur. And then you have a bursa here, and another bursa here, and another bursa here. And if those get inflamed, they can be pretty painful and you're not able to kneel. You can also dislocate your patella. You have these little, like your meniscus is right here and here. This is right in that area. And then you have these ligaments here. You might have heard of these. This is the ACL, the anterior cruciate ligament that can tear. This is the posterior cruciate ligament, the PCL. And then let me see if it's showing anything else we should mention. Synovial cavity, I already pointed out, I think. There's a fat pad right here. Patellar ligament here connecting your patella to your tibia. Oh, and then the articular capsule is back here. So any of this can become injured if you use your leg wrong. And it can be really painful and you can't walk. And often you can't drive if it's the right leg. So here's a superior view of it. And you can see the meniscus here. So this can become torn during a knee injury, and there might be a little tear and it catches when you walk. And so they'll go in and snip that. And then this is your PCL, and this is your ACL, and the articular cartilage is here protecting your bone. So watch that video to see all the muscles that tie in there and all the ligaments and how they work together. So your joint capsule is thin. It's not there, and on the anterior side, it's not there. You have a medial and lateral patellar retinacula that are on each side of the patellar ligament, and that's what they're tapping when they're testing your knee jerk reflex. And then there's at least 12 bursae, so any of those that can become inflamed. Okay, so you have, right here's that lateral patellar reticulum, and then the patellar ligament is right here. That's what they tap. the medial patellar retinaculum. You have a tibial collateral ligament over here, and then your fibular collateral ligament. So there are just, I feel like it's wrapped in every which way, connecting all of these bones together. Way more complicated than other joints for sure. Okay, then you have capsular, extracapsular, and intracapsular ligaments, fibular and tibial collateral ligaments, oblique popliteal ligaments, that's the back of the knee, arcuate popliteal ligaments. So here they are. Let me see where we're at here. So here's your arcuate popliteal ligament, your fibular collateral ligament. There's a little bursae right there. So popliteus is the back of the knee there. This is a tendon coming in from your muscle, another tendon up here. Here's the oblique popliteal ligament. So your knee is comparatively, compared to your shoulder, really secure, but any of these can be damaged and injured. And the problem is that they don't have a ton of blood flow. Ligaments don't have as much blood flow as like tendons and muscles. And so it's really hard for them to heal. Okay, so these are really common injuries that I've already mentioned, the ACL, anterior cruciate ligament, and this prevents your forward sliding of your tibia and stops hyperextension of the knee. So if you do hyperextend your knee, you could be damaging your ACL, which is what I did. Posterior cruciate ligament prevents the backsliding of your tibia and forward sliding of your femur. So if you do that, you could injure your PCL. Okay, so here's your meniscus once again, and that can be damaged, as I said, and you might have to get that cut. And then your ACL is right here, and your PCL is right here. And then fibular collateral ligament and tibial collateral ligament. And then, it's hard to look at like that. Your patellar ligament is connected to your patellar, and then this is a tendon that connects to your quadriceps. So check that out, see how your bone or how your knee works. And here's a real one with the patella flopped down. Ooh. Okay, so common knee injuries, your collateral ligaments, your cruciate ligaments, and your cartilage, like your meniscus. Those are your three most common ones. So lateral blows, meaning coming from the side, from either side, like you see in football players that get tackled. They can cause the tibial collateral ligament, your meniscus, or your ACL to be injured. Runners who change direction really quickly and your muscles aren't ready, that can cause your ACL to be twisted. And generally you need surgery. They're going to put a new ligament in. It might be a cadaver ligament, and they really take a long time to heal because of the lack of blood flow. And some of those, like ACL surgeries, take even longer to heal than like a total knee replacement. So here is an example. So if a hockey puck or a human comes at your knee and bends it sideways laterally, you can tear your medial meniscus, you can tear your ACL, and you can tear your TCL, your tibial collateral ligament. So those are really, really common. Unhappy triad, ruptured ACL, ruptured tibial collateral ligament, and torn meniscus. Okay, so here's some disorders of the joints. Cartilage tears, just like we saw, due to compression and shear stress. The fragments, like if you have little pieces of cartilage or ligament that are sticking out, they can cause your joint to lock or bind. So that's really common with meniscus. If you have a little flap that's torn off of your meniscus, when you're trying to use your knee, it can cause your knee to catch, and that's often a symptom where you know something's wrong. If you damage a ligament, typically you cannot articulate your knee like you normally could. So you're not able to move your knee. They often, like sometimes it repairs itself. Sometimes the meniscus tear kind of rubs itself off, but often you have to get arthroscopic surgery, which is where they cut a tiny hole, which is nice, and they go in there with a camera and small tools. If it's a meniscus tear, they can just cut off a little bit. Your joint may be a little less stable because you're missing some meniscus, but it's not catching anymore, so it removes that. And it also, you want to prevent osteoarthritis. So in the old days, people often did not get these surgeries done, and they should have. And so you might know old timers who had a knee injury, got bucked off a horse, something like that, and they never got it fixed, and now they can hardly walk due to arthritis. So it is really important to get these fixed just for people's quality of life. They can sometimes do a meniscal transplant or stem cells maybe to repair some of that. So here is a tear that they would go in and snip off so that that doesn't catch when you're trying to move your leg. Sprains are also really common, so that's when your ligaments are stretched or torn. Ankle, knee, and then your back are often sprained. It might be a partial tear, and because we have low blood flow, then it takes a long time to heal. So you can sew the ligaments back together. You can replace it with a graft or a cadaver, or use immobilization. Dislocations, also called luxations, are when the joint is out of alignment. You often get them when you have sprains or inflammation that can push the bone out of alignment, like in your back. And it's harder to move the joint because it's not in the right place. So you need to put it back into place generally. Sometimes it's a subluxation where it's not all the way dislocated. Bursitis I've talked about a lot. So that's when your bursa are inflamed because of an injury or because of friction. And usually this is treated with rest and ice, elevation sometimes, and sometimes you need to take anti-inflammatory drugs. And then tendonitis is when your tendon sheaths are inflamed, and this can be from overuse, like tennis elbow, when you're doing the same movement over and over. Similar symptoms to bursitis, it's hard to tell them apart. And then arthritis is a terrible disease. There's lots of different causes. It can be osteoarthritis, rheumatoid arthritis, which is autoimmune, or gout arthritis. And it can be very crippling for people, can cause pain, stiffness, and swelling, and it can be a terrible disease for some people. So osteoarthritis is one of the types. That's from wear and tear. If you don't get some of these injuries fixed, it can lead to that. Your cartilage breaks down faster. Some people are just more prone to it than others. It can also be from bone spurs. And probably by age 85, about half of Americans have it. It's normal, but you can prevent it. And the treatment is moderate activity, pain relievers, capsaicin, and hopefully it doesn't affect you too much. And then also chondroitin, glucosamine, you probably have heard of some of those, but those are generally, like, people take them, but they're generally not seen in the medical field as effective. But if they help you, I think it's probably not going to hurt you. Rheumatoid arthritis is autoimmune, so this is where your immune system attacks your joints. It usually affects people in their 40s or 50s, but it can occur earlier. So there can be like young women and men that have it, but more women than men are affected. Causes joint pain and swelling. It can flare up at different times. It can cause anemia, osteoporosis, muscle weakness. It can be a really, really terrible disease for people. So what happens is your synovial membrane in your movable joints gets inflamed, and then you get more inflammatory cells there, and it becomes a positive feedback. Remember, negative feedback is normal, positive is rare, and this is an example when positive feedback is bad. And so it causes your joints to swell, it causes them to get worse and worse, they thicken, they get even bigger. You get pannus tissue, which is a type of tissue that kind of sticks around there and forms a scar tissue. And treatment can be some really nasty drugs. So drugs that suppress your immune system are really common, and anti-inflammatory drugs, and the immune suppressants can be super rough on you. They can even suppress your immune system so much that they can cause cancer. So it's kind of a cost-benefit sort of thing. They also sometimes can give you a prosthetic or joint replacement. So there is an example of rheumatoid arthritis, pretty awful. And then gouty arthritis. Gout is caused when you have uric acid buildup in your tissues, and that can be super painful. Usually it affects your big toe. That's a common place where you'll see it show up. It can be kind of prevented with avoiding certain foods, avoiding alcohol, kind of identifying what foods trigger it in different people, and there's also drugs for it. So out of the three arthritises, that one might be the most treatable, depending on the extent to which you have it. Lyme disease is another disease that affects your joints, and that's from ticks, and we have them around here in Montana. It is caused from a bacteria. So you can, if you get a tick bite and you see that typical bullseye pattern, it's like red and kind of white bullseye, you can go to the doctor and get antibiotics and they can treat that. But the symptoms of Lyme disease are skin rash, flu-like symptoms, foggy thinking, and it can cause joint pain. Okay, so developmental aspects of joints. So by week 8 of an embryo, the joints start to look like adult joints. So that they're kind of like they look like they're articulating the bones in that way. And then they grow and change shape over time based on use, just like your bones. Over time, when you get older, your ligaments shorten and weaken. They don't work as well. Your discs can herniate, meaning they can like start to squeeze out and may rupture. And then people in their 70s often have osteoarthritis. And so it's important to keep exercising into later age so that you're able to move correctly. And that's it.